Well, it's ugly and it's staggering schools, offices, and long-term care facilities right across the country. It's this year's flu, of course. And if your family or friends haven't been affected by it yet, well, then you're pretty special. So is our national checkup panel. Doctors Danielle Martin, a family doctor at Women's College Hospital in Toronto. Michael Gardam is the director of infection prevention with the University Health Network. Jacob Boudel is a cardiologist at Peter Mundt Cardiac Centre. And Samir Sinha is a geriatric specialist at Mount Sinai Hospital. Their thoughts in a moment, but first, some facts. Is it a cold or is it the flu? It's probably the flu if you've got a combination of some of this: a fever or the chills, a cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, upset tummy. How do you get it? By being near someone else who has it, especially if you're close by when they cough or sneeze. What could the complications be? Everything from ear infection to pneumonia to heart failure. Can you die from it? Officials say 2,000 to 8,000 Canadians die every year from the flu. But those numbers have been seriously challenged because no one really keeps count, and all sorts of medical problems get lumped into that bigger number. Is it really that bad this year? Seems so. For starters, flu season started earlier this year, September as opposed to November. Just in the last week, reports from Calgary, Ottawa, and Toronto show flu numbers up and many doctors' offices and emergency rooms inundated with flu sufferers. So why does this year's strain have such a knockout punch, and why does the vaccine have such little seeming impact? Good questions. Time for the experts and some answers. Ooh, that last shot, that was a bad one. Okay, Danielle, you see it, I guess, more than anybody because you're confronted with it as a family doctor. Why is it so bad this year?
Well, a few reasons. First of all, this particular strain that's circulating this year tends to affect older people who are more likely to get complications, end up in the emergency department in the hospital. So we really see that surge in the healthcare system. And then, of course, I think as most Canadians know, and we're going to talk about, unfortunately, the vaccine this year has not been as effective as one would hope. And so that combination of things is really conspiring to give us a particularly bad season this time.
All right, we'll get to the vaccine in a moment. Michael, do you want to add on any other factors?
Yeah, I would say we've also seen outbreaks of other viruses that look very similar to the flu happening at exactly the same time. So at the same time that we saw our peak with flu, we're also seeing a lot of respiratory syncytial virus and other viruses as well. So they all add up to one big mess.
Jacob?
The irony is that in the highest risk patients, those who are older, they're actually mounting a poorer immune response to the vaccine as well. And then, in fact, the same risk factors for heart disease, diabetes, kidney failure, and others are also similarly people who mount a poor immune response. So in fact, the highest risk patients are probably the ones who get the least benefit potentially if they don't mount a good response to the flu virus.
Samir?
And as you heard, there are a number of people who die every year, related to the flu, and actually 90% of flu-related deaths are amongst older people, 65 and older, and 50%, 60% of those hospitalizations are amongst older people. So it's why we still recommend getting the flu shot, especially amongst all older people.
Okay, I want to get to why we would still take it, the flu shot, when there seems to be a very ineffective vaccine out there. And here's the proof. Look at these stats. Danielle mentioned them. In terms of the vaccine effectiveness, 23% effective this year, 2014, 2015, compared to those numbers of the last couple of years where it was more than half. Michael, what's wrong this year?
What's happened this year is every February, so last February, we actually made an educated guess on which strains would be circulating during this flu season, and then we make the vaccine based on that. And what's happened is the strain that was in the vaccine is not the same one that we're actually seeing circulating. The bad news about those numbers from the States, in fact, is they're better than probably the numbers will be here in Canada, because we have a lot more of that mutated strain here. I wouldn't be surprised if that effectiveness drops below 15% in Canada.
So, but the bottom line each year is you're gambling in a sense, because you really
gambling.
don't know what the strain's going to be.
Most of the time, the WHO gets it right. I would say on average, 9 times out of 10, they're pretty good. This year, not so much.
Samir, why take it if it doesn't work?
Well, the key is we're not saying it doesn't work. We're just saying that it's not as effective as we'd hoped that it would be, for this year's strain. So the fact of the matter is it's still to people's benefits to actually take this. It's just we can't honestly say that this is going to absolutely stop you from getting the flu. And again, it can be somewhat effective, more effective in preventing the strains that it's been designed around. But there are other strains that are out there as well, and there are other viruses and pneumonias that occur at this time of the year that we have to be mindful of as well.
Danielle, you're still telling your patients?
Well, I am, and actually, I think that this season is the perfect, illustration of why the flu shot is so important. I have this conversation with my patients every year. This is what it looks like when people aren't vaccinated, or when they're vaccinated with a vaccine that is not as effective as we would like. So, it really reinforces the importance of getting the flu shot every year. And 23% is still better than 0%. And particularly good at hopefully helping to protect those people who need it the most. So, you don't just get your flu vaccine for yourself, you get it for the people around you. So I am still recommending it, absolutely.
You wanted to add to that?
I think that, frankly, the public needs to change their expectations about influenza virus. So we're expecting a polio virus response where it's 100% effective. But if I had a medicine for heart disease that protected 25% of the patients, that would be in the water. Everybody would be taking it. So if we have an influenza vaccine that protects 25% of the population from getting a pretty debilitating illness, that's pretty good. 50% is better. And I agree, it sounds low, but it's all about our expectations.
Who shouldn't get it?
So there are certain people that shouldn't get it, people who have a severe immune suppression, people who have had a bad allergic reaction in the past, but otherwise it's pretty universally expected and recommended. There are different ways to manufacture the flu vaccine for certain people. If there's an egg allergy, for instance, there's an eggless version of it out there. So there's fewer and fewer reasons not to get it.
An eggless version of the vaccine?
Well, they make it, so you make vaccine in eggs, actually.
Right.
That's how they make it. But there is another one that's made in cell cultures that is not using the eggs.
Any made in chocolate? Do you want to add to, well, there's my doctor now telling me to take the vaccine. Do you want to add to the main point, though, in terms of who should or shouldn't be taking it?
Yeah, if you look at the history of the flu vaccine, when there was started to be recommended by the CDC in the States, several decades ago, it was a relatively small group that it was actually recommended for. And over time, that group has been expanding to here in Ontario now, and most provinces in Canada, it's pretty much everybody is now recommended to get the flu shot. One of the challenges with that is when you recommend it to everybody and you have a year like this where it really is not going to be that effective, people start to wonder, why am I getting this? And I think it's very important that in our messaging, we're clear that this is not perfect. There are a lot of challenges with this vaccine. 23% or 15%, whatever it ends up to be, is still better than nothing. But we have to be really clear that for most respiratory illness you're going to get this winter, the flu vaccine is not going to help you.
So what else can we be doing to prevent?
Well, actually, it's amazing how we come back to the basics, right? Wash your hands, wash them as frequently as you can. If you're sick, stay home. Don't go to work and infect everybody around you.
That seems to be the hardest.
It is really, and I get that it's
people.
hard. We all experience that, but you're not doing anybody any favors by showing up and coughing and sneezing all over everyone. And the other thing that I think people don't think about very much is how much we touch our faces. So, you walk around and you touch a tabletop that somebody else has just touched, and then you rub your eye or you scratch your nose, and that's one of the ways that you can bring the virus into your body. And so being conscious of hand washing and conscious of what you do with your hands can actually make a difference.
Samir, you want to add to that?
No, these are the basics that we can do. And I think the other thing is this is a great time of the year to also think about the other vaccinations that people should be thinking about. One thing that we have, maybe 70 to 80% of our society or amongst older people are getting the flu vaccination on a regular basis. That's great. But only 40% of older adults in Canada have gotten the pneumonia vaccination, which is actually a far more effective vaccination and one of the greatest ways to actually prevent the most common forms of pneumonia. So this is a great time to think about the other vaccinations that one can get, especially when this is pneumonia season as well.
Now, have all four of you had your vaccine?
Absolutely.
Yeah.
And how do they convince you to do that? And I asked you this knowing full well from earlier. How do they convince the doctors to take the vaccine?
Well, first of all, I would say for myself, it'd be pretty hard, given what I do for a living, to not get the vaccine, to be very honest with you. But
Having said that,
having
how do they
said that,
convince
I
you?
think that, physician vaccination rates are usually fairly high. Usually physicians are pretty good at getting their flu shots, as opposed to hand washing, where we're pretty bad at doing it. So I think it's something that we generally have accepted. I think where physicians draw the line is where they start being told that they have to get their flu shot.
Come
That's
on,
when it starts
they
to get
buy you off
controversial.
with little chocolate bars.
That's also
You've
true.
admitted that,
I don't
right?
think.
Whatever works.
Do you think the healthcare providers' vaccination rates are as high as we should really be expecting, though? Like, I actually find that they're still lagging behind in terms of where we should be in terms of, I mean, it should be pretty nearly universal for the patient population we take care of.
I think people have certainly argued that, and I would like to see higher vaccination rates. I think that the controversy is around at how much additional benefit do you get with that vaccination. I think that what you were saying, the issue of don't come to work when you're sick,
Very hard.
is actually a far more potent approach, given all of the challenges we have with the vaccine and the fact that elderly patients can die from RSV the same way they can die from influenza. There's 200 viruses out there that cause influenza-like illness, and we're talking about a vaccine that deals with 3 of them.
Right.
And so we really do need to change that mindset that says when I'm coughing up a lung, I shouldn't be rounding on my patients. If I have to be there, I should be wearing a mask while I'm doing it. And we're nowhere near that mindset yet.
Jacob, you're a cardiologist. I've got to take a break here, but I've got a minute. Give me a sense of the impact the flu has on a heart.
So probably a substantial amount of heart disease exacerbation. So when people have a heart attack, stroke, or congestive heart failure, or even a heart arrhythmia or inflammation during the flu season, there's a particular chance that that could be because of circulating influenza or other respiratory viruses out there. More and more we see studies that have shown a clear cyclical pattern when there are spikes in flu season, there are spikes in fatal heart attacks, as well as other hospitalizations for heart disease. And it's been seen in autopsies as well that the flu virus is actually in the myocardial cells and the heart cells. And so we think that it actually has quite an impact.
So one more argument on the vaccine, you got a 1 in 4 chance of it being effective.
Yeah, absolutely. I mean, and then there's the vulnerable patient theory where if you're already someone who's predisposed to illness and you get a bad cold or a bad flu or bad pneumonia and you're sick and you've got a ton of like other reasons, fever and other demands on your system, that could also trigger an adverse event. So another reason to get protected.
All right, I got to take that quick break I was talking about, but when we come back, this question: what's the most important thing we should know about dealing with the flu? And welcome back to our National Checkup panel. At the table tonight, Doctors Danielle Martin, Michael Gardam, Samir Sinha, and Jacob Udell. Okay, you heard that question earlier. What's the most important thing Canadians should know about dealing with the flu? So let's, Jacob, why don't we start with you? What is it? I'm taking vaccine away. We've said that enough
I'm going
times.
to keep it simple. Motherhood and apple pie. Stay home. I think we've discussed that. Take good care of yourself. Get good rest. Keep up with your fluids. Just try to relax. Try to take your mind off of work and care about yourself. And it'll pass over time. Now, if you're feeling really unwell, if it's getting worse, and that can happen, you can get pneumonia and other sicknesses like we've been talking about, then seek medical attention. That's fair. But most of the time, it's usually self-limited.
And if you do all those things, how long are you probably going to be dealing with it?
So on average, they say about 3 to 4 days. I mean, there may be residual effects, but the worst bout of it is over usually within 3 to 4 days,
All right.
depending on
Samir?
background.
I like that advice, and the key is that, especially for older adults, if you're having symptoms of the flu in particular, if you're starting to realize that you're having other symptoms like heart symptoms or those in particular, seek medical attention, because flu is a serious cause of cardiac and other complications, especially in the elderly. So
But
seek
your
that
family
advice.
doctor can usually deal with it.
True.
You know, so I think rare are this not super rare, but rare enough are the situations where it's truly an emergency. And I think it is important for people to try to go to the place where they can get care, where they're not going to be waiting a long time. You know, I think about those older people who are sitting in the emergency department for hours and hours and hours. Very often, an early pneumonia can be caught and dealt with, for example, in your family doctor's office.
So speaking of which, so antivirals, do you have those in the family doctor's office?
Yes, or we have access to a pharmacy and
Right.
to our patients.
So what do you feel about it in terms of antivirals?
Yeah, I think antivirals have a reasonable impact on flu. The trick is you have to get them early.
Really
The
early.
earlier the better, and that's a real
First
challenge
24,
with those.
48 hours, right?
Exactly,
Max?
even earlier if you can, and that's a real challenge. My advice in terms of what to do during the flu season is pretty simple. If you're sick with flu-like symptoms, keep it to yourself. The number of people that I see coming in to visit grandma in the hospital and then subsequently make that person ill and potentially deathly ill, it's actually staggering. We have a culture of walking around while sick and infecting other people, and all the other challenges with the vaccine, et cetera, all pale in comparison to that behavior. We have to stop doing that.
All right. Good advice to end this on. Thank you all. Very good discussion. And thanks to you as well. Lots more on our website about the flu. That's cbcnews.ca/thenational.